Hello, good afternoon, ladies and gentlemen, dear friends. I guess I can take this off now, since I'm alone here, and I'll get rid of this. We don't want to be disturbed. Well, nice to have you here. It's nice that you have found the time there to connect with us in these difficult times. The situation everywhere is complex, it's rather new, so we are learning as we go. The situation changes every day, so we're learning new things and we're coming up with new solutions every day. But we're doing our best to sort of keep everything running and to keep fulfilling our mission in trying to fulfill your dreams and to get pregnant. Now, it may be a difficult time, but human reproduction, or IVF, assisted reproduction, as it's and it should be called, it's no more than that, assisted reproduction. So since we only assist, there's still a whole lot of natural processes that we need to respect, and therefore it's a rather lengthy process usually. I know that's relative, so I'm not talking about months or years, but I'm talking about weeks, and I'm talking about respecting the menstrual cycle of the woman, which we always need to pay attention to. Therefore, we can use this time, even this complicated time, to consult, try to get advice, try to get the tests going that we might need prior to starting the treatment, plan the treatment, just set everything in such a way that whenever the borders will open and the situation generally will become a little more easy, a little more safe, a little more flexible, then we can start the actual treatment as soon as possible. I have some very interesting questions here, so we'll dig into details just a little later. But at this point, I'm still going to finish my brief monologue in trying to give you an idea what are these tasks that I'm talking about in trying to get ready for the IVF treatment. There are various procedures that we plan. It can be the stimulation of the patient's own ovaries in trying to get her eggs, fertilize them with the sperm cells of the partner, and then transfer the embryo in the uterus. In such a case, we always need to check some blood tests. There should be an ultrasound performed before we start the stimulation. And the stimulation is usually started from day 2 of the menstruation. So these are the things that we can discuss and eventually plan and eventually do or have done back at home before we plan the actual stimulation. Sometimes it takes a little while to get the necessary medications. It's always a good idea to take some vitamins, antioxidants for the gentleman and for the woman, for the gentleman to spruce up the spermiogram. So that's one way how to use that time. If it's a cycle with frozen embryos, a so-called cryo or frozen embryo transfer, then once again we should discuss and plan what the best procedure will be to set up the endometrium, the uterine lining in the uterus of the woman. And that sometimes can take a while. So once again, we can use this time to run a test cycle to see how the uterus and the endometrium react to the hormones, whether this specific or this typical dose of hormones is enough for you, and we can tailor the actual treatment then more to your specific needs. Another possible procedure, another direction could be a cycle with egg donation, and there again we can use that time to prepare both the patient and the donor and set everything up in such a way that when the borders open and when we are ready to actually start the transfer cycle, we won't be delayed with any other necessary examinations, blood tests, and otherwise. We are dealing with authorities pretty much on a daily basis. We're trying to work out some details regarding traveling, regarding some really crucial, really interesting topics, issues, such as crossing the border for treatment as an exception. We'll talk about that in just a little bit. Or perhaps even postponing the treatment and breaking some of the limits that are set by law. For instance, we are only allowed to treat the patient until her 49th birthday. And it can happen now that with several of our patients who are going to reach their 49th birthday now in the next couple of months, be it June, July, or August, we might not have enough time to actually start and finish that cycle before that date. We are discussing these issues with our colleagues, with other clinics, and with your authorities to see if there's going to be some official way to get such a postponement, okay, without breaking the law, or so that we wouldn't have to do it in any partisan way without the blessing of the authorities. But we'll work on that as we go. And I don't only mean now during this little talk and this little Q&A, but actually in the days and weeks to come, there's going to be another important point next week on the 11th, when the government, the Czech government, because I failed actually at the beginning to introduce myself, which I might as well do now. My name is Tomáš Frgala, or Thomas, and I'm the head of the IVF program here at the Unica Clinic in Brno, Czech Republic. So the Czech government is going to have another sitting next week on the 11th to see whether this special state, this critical state, is going to be prolonged, how much, if it's going to be 2 more weeks or end of April. These are the alternatives that have been discussed in the media in the last couple of days, and we'll see what that brings for us and our patients. At the same time, we'll try and work out some of the exceptions, such as the documentation that might eventually allow the patient to cross the border for treatment, especially in cases where there's a risk that the postponement might bring complications. Because it's not only the age limit, there are other situations, such as the patients with endometriosis, where there's risk of progression of the disease, and the treatment should be done without any delays. We have had actually, but this is merely an anecdote, it's not the rule, we did have 2 patients who actually had treatment running when this critical stage with closed borders came along, and we were able actually to finish their cycles all the way up to the transfer of the embryo in the uterus with some special documentation that we issued for them, and with this special permit, they were able, both of them actually, to pass the border and finish their treatment and get back home safely. However, as this was merely anecdotal and it's not an official stance that I could promise or say to you as a rule. So we'll have to eventually stay in touch, directly or via our coordinators. And we'll have to work on these issues and answer these questions as the situation develops. We will definitely know much more by the end of April, and we are hoping to be able to start the treatment cycles, actually the full range of them, in May this year. But this is, at this point, it's merely my hope. So we'll see, we'll get to that. Of course, the most important thing is that we all stay safe. We have been working on this from day one of this crisis, keeping all the necessary hygienic and anti-epidemics rules. I hope you are staying well and safe, socially distancing, and doing your best just to stay healthy, stay out of trouble, and I hope we can keep doing that same in the future. Okay, I see that we have quite a number of questions here, so I'll start with the ones that I have actually printed here that came a little earlier, and then we can eventually switch to the questions that I see on the screen there, the fresh ones. If that's okay with you, I might mention the first name just so you know that this is the one that you have sent, not revealing anything. So this one is from Robert. Can the current situation affect the treatments in some way, and how? How many eggs do you harvest if you take eggs for IVF? I take it for ICSI. And do you have insertion of an embryo, and what is the price? Okay, so let's start with the first one. That will be corona. Okay. Of course, yes, the situation with the coronavirus does have a direct effect on us in that regard, that the borders are closed now and you cannot come for the necessary visits. We are able in most of these procedures actually to have some of the points, some of the checkups performed at your place, back at your home. The question, however, is whether your physicians would be able and willing to help out and perform an ultrasound to check on your endometrium or to prescribe the medications. So that's one question. And then usually in the finale, okay, for the oocyte pickup, for the embryo transfer, it's usually no more than 2 or 3 visits, but we have to be able to get you here for those. So at this point, even that fact that the borders are closed is affecting the treatments. Regarding the coronavirus itself and its effect on, for instance, the stimulation of the ovaries in the woman, honestly, we don't know. It's a new situation, it's fresh. There are no studies yet. The data is being collected. Probably the answers to some of these questions will not be known for months to come. But at this point, it doesn't appear that the infection should bring any specific risk to a woman that is being stimulated and that has an oocyte pickup plant. However, the oocyte pickup itself, which is usually performed in complete anesthesia, is probably not advisable during the time of the infection. And since the stimulation itself takes about 2 weeks and the infection can appear during that time, then it's questionable whether it's a good time to start the stimulation right now or whether to maybe postpone it by a month or 2 until the situation generally settles. We are, of course, following all the recommendations in regard to that of the societies, the ASRM, the American Society for Reproductive Medicine, the ESHRE, okay, the European Society for Human Reproduction and Embryology, and the Czech Society for Assisted Reproduction. Whereas the recommendations about 2 weeks ago were quite strict and said don't start any new treatment cycles. It has been loosened to a certain extent about 2 days ago on the 1st of April, but it's still questionable whether this is the best time to start the actual stimulation. So consulting, definitely yes. Planning, yes. Preparing, yes. But starting the stimulation, that might be a better idea to wait a little bit. So yes, the situation is definitely now influenced by this. As far as the possible effect of coronavirus on the fetus in the early pregnancy, there's no data. so far that we can, lean upon and that we can cite. But so far, there haven't been any cases reported that would document actually the cause of a missed abortion or other complications during early pregnancy caused by the coronavirus. So there hadn't been any cases reported like that as far as I know, but the data is being collected as we speak. How many eggs do we harvest from the ovaries? Well, that depends on the ovarian reserve. It depends on the reaction of the ovaries of the patient or the donor to the stimulation. It's quite individual. It can differ from cycle to cycle, even in the same woman. It depends on her age. It depends generally on the capacity of the ovaries. The AFC, antral follicle count, the number of follicles in the ovary, should be between 5 and 11 in every cycle during the reproductive age. So that's on each side, in each ovary. The total there would be somewhere between 10 and 20. Usually it's a little less because not all the follicles, they grow at the same speed or with the same dynamics. Not all the follicles bring during the stimulation the ripe egg, and then not each and every from those ripe eggs is healthy and fit for fertilization, but an optimal, a good number of eggs obtained via the stimulation, the oocyte pickup, a safe number at the same time, is somewhere around 10 to 15. So that would be a good number. Even 8 or 10 can be all right, but sometimes we only get 2 or 3, especially in older patients where the ovarian capacity is not that high anymore, and we can succeed even there. But many specialists say what you need is 1 healthy egg and 1 fit sperm cell to fertilize it, and then a whole lot of luck that the embryo develops nicely and eventually nests. Do you have insertion of an embryo and what is the price? I'm not quite sure if I understand the question correctly. What would be the insertion of the embryo? The insertion of the embryo, or what we call usually an embryo transfer, is always a part of the process. It depends on where the eggs or the cells, generally the gametes, come from. Are they from the patient? Are they from the donor? And how do the embryos develop? Is it a fresh embryo or a frozen embryo? But each and every cycle is actually finished and fulfilled with the eventual transfer of the embryo in the uterus. So yes, we do that every time. And as far as the pricing goes, I'm not going to spend 20-30 minutes on the individual price lists, but if you contact our coordinator, then they will be more than happy to send you brochures, to send you price lists, and give you an explanation regarding the prices for the various individual procedures. Okay, let's take a look at the next question. What is the impact of COVID-19 on your clinic? And once international travel restrictions are lifted, how much time would be needed to plan and then implement a treatment? This one is from Alexis. Thank you for the question. Well, we talked about the impact already. Many patients cannot reach us at this point, so we're focusing on patients in the Czech Republic who don't have trouble attending the clinic, but we have been limiting actually the activities and procedures in the past 2 or 3 weeks in accordance with the recommendations of the authorities and the societies. But we're open for consults and for examinations. We have finished actually gradually the cycles that have been running already, and now as the situation is starting to lose a little, then if there is a case where postponing the treatment may bring a risk for the patient, then we can even start the stimulation. Now, once the international travel restrictions are lifted, we can start pretty much immediately. Once again, usually the starting point is the menstruation, or better yet, the day 2 of the cycle, be it the ovarian stimulation that usually starts on day 2, on the second day of the bleeding. Then be it the frozen embryo transfer, the preparation of the endometrium starts again on the second day of the cycle. And a similar rule goes for the cycle with egg donation. So the question, when can we start or how long does it take, is usually connected to our question, well, when did you have your last menstruation? And when do you expect the next one? And that's the answer. If you expect the next bleeding in 2 days, we might be able to start as soon as that, in those 2 or 3 days, start the stimulation. If you're in the middle of the cycle, we might have to wait for 2 weeks or so. Also, it depends on the examinations, the results, but we can take care of that exactly during this phase. During the consult, most of the patients have absolved some kind of treatment back at home, so if they share the results of the lab work and of their previous experience, we can build on that and we can be pretty much ready to start anytime. What can we be doing now to prepare for the transfer when this is over? This one's from Darnell. How long after international travel is okay can we get in for our transfer? Very similar question and pretty much the same answer. The transfer usually, once again, respecting the natural rules of the menstrual and ovulation cycle. So the transfer, or in this case, the equivalent would be the nesting of the embryo, the time when the embryo enters the uterine cavity and looks for the perfect place to nest, is usually around day 19 and 20 of the cycle. So usually after about 3 weeks from the menstruation. So to answer this question directly, when are we ready for transfer when this is over? Well, 3 weeks after the menstruation. First we need to reach the menstruation and start the treatment. So once again, we can start pretty much immediately. There is a longer question from Hannah from Poland now. And this is actually regarding an issue that we have mentioned at the beginning. Frozen embryos getting ready for the transfer, but the age limit is in July, and the borders are now closed. Well, we're working on this, and hopefully we might be able to actually give you some new information at the beginning of May, maybe with these special permits that would allow you to cross the border. Otherwise, we would work on the exception to those rules, but as I mentioned, we're working on these every day, and the new rules are coming up every day. So I think waiting until the end of April would be a good idea. Still, I think we should be able to do this without any problem. Okay. Is it possible to start in April? Will it be possible to find a donor? And can I come to Czech Republic? From Andrea. Well, we have pretty much talked about this already. April, I think, is too optimistic. I pretty much expected the borders to be closed at least until the end of April, possibly longer than that. Will it be possible to find a donor? That would be a yes. That wouldn't be a problem. We have donors on standby, pretty much listed in our database. Usually they're on an oral contraceptive, an anti-baby pill, and they're ready to stop that pill and start the stimulation pretty much at any time. Once again, stimulation starts from day 2 of that menstrual cycle. So looking for the donor shouldn't be a problem. We don't have any long waiting lists, and I don't think that would be an issue. But unfortunately, the last question, can I come to Czech Republic? At this point, the answer is still no. So we'll have to work on this and hopefully plan for May or June. What is the best way to prepare for IVF during this time of uncertainty and stress? Any special recommendations? And does IBS have any impact on IVF treatment and how to mitigate it? Okay, for Martina, thank you for the question. Yeah, I'm not going to have any specific recommendations. beside the ones that come to mind automatically, pretty much to each and every one of us, okay? Let's try to stay out of trouble. If you're smoking, don't smoke. If you're drinking a lot, don't. But these are definitely not your problems, and that's not the point of the question. So generally, a healthy lifestyle, as long as it's possible, a healthy, steady diet as far as the irritable bowel syndrome goes. Just, keep your diet. You probably have one recommended from your physician. Nothing special is necessary here as far as the ovaries go or the reproductive system in general. There is maybe one thing that comes to mind, and this might be generally important, and it's probably not going to be a point of any of these questions specifically, so I might as well mention it now, even though this hasn't been the point of Martina's question. One thing that is important, we have mentioned a little earlier, 5 minutes ago, that pretty much every procedure and each treatment is finished, crowned by the transfer, the insertion of the embryo in the uterine cavity. For that, the lining has to be perfectly prepared, and the uterus should be active, it should be of a certain size. If it's a situation where the patient doesn't have a regular cycle anymore, and if she has such a situation, this so-called amenorrhea, okay, the situation without any menstruation, without any cycle, for a prolonged period of time, the uterus can shrink slowly, it can become hypertrophic, and when it's that small, it might not be as fit for the pregnancy as when it's of normal size. This is usually very easy to solve with some hormonal substitution. Usually it's pills like Femoston, Divina, there's plenty of these, and the name is different in every country, but usually it's the same. It's just estrogen for about 11 days, and then the combination of estrogen and progesterone for 10 more days. And a cycle with these pills will bring the hormones back, revive the uterus, bring the cycle back, and the uterus usually starts to grow again to reach its original size. So this would be one thing, actually, generally, not just to Martina, but to everybody. If you want to start the treatment whenever the time is right, as soon as possible, just make sure that your uterus is ready. If you have a regular cycle, don't worry about it. But if you don't have one, maybe talk to your gynecologist or talk to us. What to do to revive the system and to keep it, alive and ready for the actual transfer cycle, for the treatment, and for the nesting of the embryo. Okay, what can we do at home to prepare for the IVF treatment from Bonnie in terms of daily life, diet, health, etc.? Pretty much the same answer, just as we said, just the usual healthy lifestyle. Regular diet, overweight can be a problem on both sides, okay? For the gentleman, it can have a direct effect on the quality of the sperm cells, and in the woman, especially if we're thinking about her own stimulation using her own eggs, then this can be an issue also. So that's one thing actually to think about, look after. Even though this is usually like a long-term task or long-term project. Also, Bonnie asks, the English-speaking coordinator at the Prague clinic has recently left. Who can we contact there if we have any questions? Actually, I took the liberty of contacting the director at the Prague clinic, Mrs. Michala Shilhava, and she promised to send you an email immediately, okay, this afternoon. So you will be in contact with her today, and you will get a recommendation, a name, a contact for your new coordinator as of today. Then there is a question in French, which I will not attempt to translate or read directly, but it goes like this, basically, from Nadia. My AMH is 0.05. If I plan on treatment with donated eggs, what chance do I have? This is actually a wonderful question for me to talk a little bit about this topic. AMH, or anti-Müllerian hormone, is one of the two factors that we use to estimate the ovarian reserve, to see what the strength is of that reserve, okay, whether the ovaries will be able to bring a dominant follicle in the cycle, more follicles during the stimulation, whether they still work well, and then there's plenty of eggs to actually obtain via maybe a stimulation during the IVF cycle. So once again, that's the anti-Müllerian hormone. That's one factor. The other one is AFC, antral follicle count, the number of follicles that we see on the ultrasound. The AMH has a certain range. The age of the woman is quite important in interpreting this result, but it stands here 0.02. That's extremely low. One thing that's important in communicating this, just sort of a warning or request, if you're sending your AMH value and want us to comment on it, please don't forget to add the units. There are different units being used in Central Europe. There's, for instance, nanogram per milliliter. There's different units used in Great Britain, like picomole per liter. So just add the units just so we know what the true value of that number is. However, in this case, 0.02 means that the ovarian reserve is critically low. It's very, very low. So I'm afraid, and you probably know this, judging by how the question is actually written, that hoping for a pregnancy from your own eggs, in this case, unfortunately, the chances are very, very low. The experts usually say to that question, I have asked several times actually at various meetings and congresses, well, at what AMH value would you not stimulate anymore? And the answer always was, no AMH value should serve as a disqualifying factor for the woman. So if she hasn't tried the stimulation, of course you need to take into account everything else, her age and the state of her ovaries. But if there hasn't been a stimulation, we can always try. However, if there has been one and it was unsuccessful, or if she's of higher age and the quality of the eggs will be compromised, or if it's critically low, like in this case, then egg donation is the definite answer. However, and this is critical, for egg donation, the AMH, so the capacity of your ovaries, does not play a role anymore. So it's completely irrelevant. You're being automatically catapulted from a group with a chance lower than maybe 1%, or maybe between 1 and 5%, which is usually cited as a success rates in women trying to get pregnant with their own ovaries via IVF between 40 and 45. With egg donation, it's around 55-60%, and it's regardless of the capacity of the ovaries. Once again, the only condition is that the uterus is alive and well, that the uterine lining is growing, or that we help it grow with that substitution that I mentioned a little earlier. So, in answer to this, your chances to get pregnant with donated eggs are very, very good, and the AMH doesn't play any role anymore, okay? Next question from Jill. My cycle has been interrupted. We have frozen embryos, cryopreserved, okay, from our donor. Is there any idea of a timeline for being able to travel to the Czech Republic to complete the treatment? Okay, honestly, I have to say no. At this point, as of today, April 3rd, I don't know. I don't know. We'll learn throughout April. And once again, I have said this a couple of times today, I'm hoping that May or June, the situation may become a little more friendly. Either the borders will start to open, or if that's too optimistic, then we might be able to work out these exceptions, okay, for for our patients these passing permits that would allow them to cross the border, if just for that one visit and for the transfer. They don't need to, stay here a long time. They don't even need to look for accommodations here. This is usually a one-day process. Especially for the cryoembryo transfer, it's about a 60-minute visit to the clinic, but it's also going to depend on the rules back at your country, which differ definitely from one country to the next, and it will depend what they are at the moment. Okay. Genetic incompatibility of prospective parents and chances of conception and full-term pregnancy, from Afsana. This is a very broad topic, and I probably won't be able to answer satisfactorily directly like this. We would have to talk about this. We would have to discuss it. If need be, then we would have to discuss it eventually with a geneticist, or maybe you have already absolved such a consult with a specialist for genetics. So please send your results or eventually bring them for the consult, and we'll look at the specific situation, what is meant by the incompatibility. And then there are various ways to go. It depends on many factors, on your age, of the specific genetic problem that we're talking about. And we can offer actually a wide range of solutions, starting from the PGTA testing of the embryos in the IVF cycle, meaning that the abbreviation goes for pre-implantation genetic testing for aneuploidies, and aneuploidy being actually a chromosomal aberrance in the embryo, so a genetic problem in the embryo itself. And the biopsy for this test is being performed on day 5 of the embryo development. So we can plan an IVF cycle where the embryos on day 5 will be tested and then cryopreserved, and then based on these tests we will plan transfer of only these embryos that are euploid, meaning healthy, promising for nesting and a healthy pregnancy. But if it's a more specific, deeper genetic problem, then there's the other alternative, PGTM, pre-implantation genetic testing for monosomal problems or diseases. And these are usually a little more expensive, a little more complex, sometimes a lot more complex, but still in many cases it is possible to actually detect which of the embryos are healthy, which may not be, and only the healthy ones, which don't carry the problem inherited from one of the parents, then are being used for the transfer. Or if it's a really serious situation where there's actually little to zero chance that there will be some healthy embryos, then we can offer, or we can discuss a possible treatment with donated gametes, donated sperm cells, or donated eggs. So there are many various ways to go, and we would have to discuss this in more detail during the consult. Do you offer embryo donor program too? My AMH is very low. The right tube is blocked with scar tissue. I have 3 failed inseminations and 1 failed IVF. I have been pregnant at 23 but miscarried at 9 weeks. I'm sorry to hear about that. I am age 42 now, so looking into the best options for me now. Okay, yes, we do offer the possible transfer of an embryo from donated gametes, from donated sperm cells and eggs that have actually been cryopreserved on day 5, that came to world, with this combination of donated cells from both sides. But in this case, even though at the age of 42, with the other issues here, egg donation is definitely the way to go. We would have to discuss the issue of the sperm cells in more detail. We would need to see what the spermiogram is of your partner, what the age is, what his general history is. And there might be an option actually not to go for an embryo from donated sperm cells and eggs, from donated gametes from both sides, but only for a cycle with donated eggs, which are fertilized using your partner's sperm cells. And that would be a very strong option that would give you a high chance to get pregnant. Next question from Angela. We were due to start in May. In your opinion, how long a delay do you foresee happening? Once again, I'm hoping that in May the situation is going to start to loosen up, but we may be forced, if the borders are still closed, to talk about a little later, like June or July. I'm hoping for the best here, but we're learning as we speak. And you know, if you look at the news each and every day, this is a new challenge and a new situation for each and one of the countries all around the world that have come in touch with this pandemic every day. What are my chances of getting pregnant naturally or by having insemination with my fiance's sperm? If I had 3 miscarriages by my ex last year and 1 by my fiance last year, a total of 4. This year I had another miscarriage, but it always happened before taking the pregnancy test. So what's your advice? I am 40 years old now, or maybe I was 40 years old on the 27th of December. Wendy. Okay, this is a very interesting and quite a wide issue actually. So it would be definitely a good topic for at least a 1-hour consult. And yeah, Wendy, if you can contact the coordinator and set it up for me for like a 1-hour Skype consult or telephone consult, even WhatsApp works, but that's technically a little more straining. But Skype works usually very well. Then we'll dig deeper into this. There are various possible causes of repeated miscarriage. 4, that's quite a number, and these should be examined. The 3 usual suspects, the 3 major issues that can play a role are genetics, hematology, and immunology. Also, the state of your uterus comes to mind. So, as far as the genetics go, a genetic consult might be in order with the geneticist, okay, a blood test for a karyotype, and then based on that, maybe other examinations. But hopefully that will be okay, you'll see. That's probably not the one I would start with. I'll get these in order just a little later, okay? Hematology, there could be an issue such as hereditary thrombophilia, where the blood clotting is too strong or too fast to kick in and cuts off the embryo. This can be again diagnosed via a blood test, and it can be solved via application of low molecular weight heparin injections. This is usually consulted with a hematologist. So that might be another issue. Immunology, that one is very complicated, very complex. And in such a case, a consult with a specialist for reproductive immunology would be in order. As far as the uterus goes and the possible changes there, a diagnostic hysteroscopy, where the physician, the gynecologist, looks in the uterine cavity using a camera and actually sees if there's any irregularities, any discrepancies there. So what I would probably start with is the hysteroscopy, and then at least the test for the hereditary thrombophilia, or a consult with the hematologist, and a genetic consult. On the other hand, I have to admit, with 40 years old, that can be an issue in itself. As I have mentioned earlier, The eggs get older with the woman, and with 40 the quality is usually lower. So that may play a role. However, the sperm cells also do, and they can play a certain role there. So a spermiogram in the gentleman, just to see if the numbers are okay, might be a good idea. I know you have been getting pregnant spontaneously, naturally, so there shouldn't be a major issue with the spermiogram, but it could be that the morphology of the sperm cells is poor. It could be that maybe there's a higher DNA fragmentation rate, and that can play a certain role. So a consult with a reproductive medicine clinic, with an assisted reproduction clinic, including a spermiogram, might not be a bad idea. Okay, so these were the questions that I had printed. I understand there's more. Claudia asks, I want to access your services, donated X. Tell me if myasthenia gravis can affect the transfer of embryos. This can be an issue. We want you to stay healthy generally, and this is something that you, however, would have to consult with your physician, maybe your immunologist or your physician who's taking care of this. For the transfer itself, this might not be a problem. But the issue always is, and if it's a specific diagnosis, be it an oncological one, be it a specific genetic diagnosis, like the Turner syndrome, which can be connected with some specific risks, or other issues like this, we always strongly advise the patients to talk to their specialist first. Ask them whether pregnancy in general is possible, if it's not contraindicated, if it's a good idea, and to have it, optimally in writing that it's okay for them to get pregnant. And then we can discuss actually the treatment itself, the ways to treat, what the strain might be for your organism, and how this might affect you, okay? So please talk to your specialist first. For the transfer itself, this shouldn't be an issue. But my number one question there is always, will you be okay during the pregnancy and after giving birth? Okay, let's take a look at the next question, please. That's it. That's it for now. Wonderful. All right. So if that's it, I'm sure further questions will come later. If they do, don't hesitate to contact us. The contacts there are available. If you write to ivfunica.cz, then it will be forwarded to a coordinator in the appropriate language, be it English, German, Spanish, French, Italian, Polish, Serbian. I'm sure I'm forgetting somebody, but that's one way to go about this. We can set up a consult, we can set up via Skype, of course, or set up a consult via telephone. We can discuss the options, we can discuss the preparations, the recommendations, or the needs that we actually have to be able to start your treatment and as soon as possible. Once these tough times are over and once the borders are open and we can go outside and live our normal lives, which I'm hoping will be soon, but we're still at the point where at the end, I don't want to sound down or pessimistic, but I do want to share this sentiment with you. Actually, I want you to stay out of trouble. I want you to stay safe. And I want you to stay healthy. I'm going to keep my fingers crossed, and I hope we can all, start working on this and meet very soon. I understand there's one last question coming. What does the consultation cost? Okay, that's a good question, of course. Usually the consultation in person, including the spermiogram, costs €145. A Skype consult is cheaper than that, significantly cheaper. It's less than €100. But if you contact the coordinator, you will get the exact quotes, you will get the price lists, and you will get this information in detail, and all of that is free. Only when you really want to continue and you want to consult the physician, then that's the next step. Then you pay for the actual consult. But before that, the first contact with the coordinator, that's absolutely free. And then only when we start to plan further treatment, then we'll talk about money. But I'm sorry, I hate to talk about money. I know it's the part of the process, it's crucial, it's very important to you. I respect that. But once again, the first contact and the information from the coordinator, that's at no cost. Once again, thank you for your cooperation. Thank you for your interest. Please stay healthy. And if you have cycles running, if you want to start to plan the cycle, please contact your coordinator or contact us generally by the end of this month. And I hope we will be able to move it, along and start again, hopefully by May. Also check our website. It will be updated on a regular basis and the newest developments might be there. And there's one more question coming. What is the age limit? Once again, the only limit that we're dealing with is the 49th birthday. After the 49th birthday of the woman, we are not able to treat anymore. We cannot treat. If you have cryopreserved embryos, for instance, and you turn 49, then the only option is to take these embryos and have them shipped, for instance, to, just an example, Spain, where there is no age limit. But that's the only limit there is. Otherwise, generally, if we talk about various types of treatment, then the age plays a very important and very specific role, but we will get to that as part of the consult and your specific situation. Okay, thanks again. Have a great weekend. Stay safe, guys. And it was nice to talk to you, although it was less fun for me because I didn't see your reactions and I couldn't share and answer in more detail, but I'm sure with many of you we'll get to that. Have a great weekend, and I hope to see you soon. Bye.